Now we'll discuss first aid treatment for spider bites, tick bites, and scorpion stings. These encounters can be alarming, but knowing the proper steps can help ensure a swift and effective response. First, know that millions of people are bitten or stung every year in the United States alone, and most of these are harmless. We want to focus on generalized treatment and what to watch for in more severe cases. The priority is always safety. Once you and the victim are safe, see if there's a way to identify what bit or stung you, as this can help identify appropriate treatment if needed. Since all of these bites or stings will have punctured the skin, gently washing with soap and water is always recommended. If any concerning stings or signs or symptoms are noticed, seek medical help immediately. In that case, watch for discoloration or the skin blistering, nausea, abdominal pain, difficulty breathing, change in responsiveness, or significant pain. If there are no immediate concerns, here is how we handle these independently as long as no concerning symptoms are noticed. For spiders, if you're in an area known for venomous spiders, remove yourself from the vicinity to avoid further bites. It's important to identify the spider responsible for the bite. Then, wash with mild soap and water. To reduce pain and swelling, elevate the bitten extremity and apply a cold compress or an ice pack wrapped in a thin cloth to the bite site. Leave it on for about 10 to 15 minutes each hour. For suspected or confirmed bites from venomous spiders such as black widows or brown recluse spiders, it's crucial to seek immediate medical attention. Call emergency services or visit the nearest hospital. Now let's talk about ticks. If you find a tick attached to your skin, remove it promptly, since the longer they're attached, the more likely they are to transmit diseases. Use a fine-tip tweezers to grasp the tick as close to the skin surface as possible. Pull away from the skin steadily and slowly with firmness, avoiding twisting or crushing the tick. The skin will tent and the tick will eventually let go. Clean the area with mild soap and water. If you're concerned about tick-borne diseases, you can preserve the tick in a sealed container or a plastic bag. This may assist healthcare professionals in identifying the tick and determining the risk of disease transmission. Please note that if the head comes off and stays embedded in the skin, this is a call to the medical professional for help. Now let's cover scorpions. Remove yourself from the area to prevent further stings. Clean the sting site with mild soap and water, similar to the spider bite, and apply a cold compress or an ice pack wrapped in a cloth to the sting site to help with the pain. While most scorpion stings are harmless, seeking medical attention is essential to be safe, as venomous species can be fatal to humans. Call emergency services or visit the nearest hospital immediately. Remember, prevention is key, so take precautions by checking your clothes and wearing proper attire whenever these creatures are common. Stay calm and follow these steps if you encounter a bite or a sting, and as always, seek professional medical help whenever necessary.